Hello, my dear students. Today we are going to talk about a pandemic situation that we are facing today, that is COVID 19. This coronavirus disease 2019. So, this has started from Wuhan city in China on December 2019. So, to start with, I'd like to say that this disease starts as a upper respiratory tract infection and it spreads like a droplet transmission. So these patients usually present, most of the patient, 90% of the patients present with high grade fever at the beginning. So something around 101 degree Fahrenheit or more. So after that, the most common presentations would be cough, throat pain, dyspnea, and rare presentations could be diarrhea. So we can say that to prevent this spread, WHO has told a lot of steps, through which the most effective and most important step is to prevent the transmission is hand washing. So we'll demonstrate a technique of hand washing later as another video, but here we would like to know what are the other ways of stopping ourselves from getting transmitted. So the important points is, number one is always and always hand washing. Number two, avoid hand shaking with other people. Number three, use mask. You can use any kind of mask usually. You can use a cloth mask wherever it's available. You can use a 3-layered mask, or you can use an N95 mask. We will demonstrate about the N95 mask later in another video session. So this is how N95 mask looks like. So we'll talk about it later. And then the next important measure is social distancing. So when you're going outside or when you're going to any store or anything, anywhere to buy something, so keep some distance from the previous person or the next people, something they are around you. So, and also when you're at home, try keeping self distancing from your own family members. So in these ways you can definitely protect yourself from getting COVID-19. And whenever you are exposed to some material or somewhere when you went out and came through, so the effective way could be hand washing, or you could use alcohol drops. Hand drops can be used. I think that should be enough. And then these patients, when they initially present with fever, it's easily to localize them when the doctors are approaching them for house visits, and then when they'll be looking for temperature through a digital thermometer like this. So this will record the temperature. So whomever has a temperature of more than 99 or 100 degree along with upper respiratory tract infections, they would be screened for further, if needed, further COVID-19 testing. So these patients on physical examination, when at home, when you have to know are you having any trouble related to COVID-19, so you can check with a breath hold test where you can hold breath for around 30 seconds. So we'll demonstrate it how to do that, but initially take a deep breath, hold it for 30 seconds. If you're able to do so, most probably your lungs are in fine position for the meantime.